So neural therapy is based on the theory that basically any trauma or infection or surgery can damage a portion of your autonomic nervous system. And this can produce any kind of long-standing disturbance in your electrochemical or electromagnetic function in your tissues. And that interference field can cause a disruption in the function of the nervous system. It can cause pain, or it can even contribute to disease, and it can be localized or it can be widespread. Oftentimes, we will follow Procaine with a little bit of ozone gas subcutaneously injected just under the skin, often into scar tissue, because it will help to break up adhesions or help to loosen the fascia. I have this injury, and invariably I look at the injury, and if I see scars around that injury, I got to do the scars first, because the scars invariably are going to be linked to limited mobility. And it's not always the size of the scar that matters. And truly, I will tell you, and I'm assuming there are some nurses and providers on here. Sometimes the most needle phobic people are nurses and doctors, but
Yeah.
anyone can have needle trauma in their past. And I think that's a big part of it. And no matter how little or long the needle is, we're talking through the whole thing, because this is an exercise in communication, because every person has gone through different experiences, but genitourinary, anything in the pelvic bowl, UTIs, interstitial cystitis, infertility, impotence, incontinence, any IBD, IBS, prostate issues, sciatica, GERD, anything respiratory, COPD, emphysema, pneumonia, bronchitis, histamine issues, RSV, pneumonia, mold illness, asthma, mental health issues like depression and anxiety. For people who have tried everything, I can't tell you how many times I've just put a needle in and it didn't hurt, but they just burst into tears. And they're like, "What is happening? What did you do to me?" And I said, "Oh, I forgot to tell you, this could bring about an emotional release, but it's okay. You're fine. I just breathe through it. It's okay. Process whatever emotion or experience you're thinking about, and let's let this pass so that you can." And that is definitely one of my favorite things to do for people, because you can watch people in the moment just reset, whether they are angry, whether they are in pain, whether they are just amped, stressed out to the max, whatever it is. It's not a cure all, but it just is it's a reset. Yeah. And C-section scars are one of those things. If you ever see a C-section, that I know the first one I watched, just no wonder women have such bad back pain after C-section. It's brutal. It's so important with scars, especially C-section. I have had that's been some of the most amazing results, is to have women say that sex feels better, that their mobility is better, that they don't have incontinence like they did. Now, neural therapy it is so much fun. Well, I love all the things I do, and I think I do a lot of cool stuff, but I think you do a lot of cool stuff, because sometimes we get so tired of feeling the way we feel because we felt this way for so long and we've heard the same thing over, and it's just so old. And then to actually hear something that makes sense, and it's, oh, I never thought of it that way before.